Welcome to week 10 of the Adult Weight Management Project. This week we're going to discuss bariatric surgery. First, I'd like to make a correction from last week. I said that this would be our last presentation. There's actually one more after this, and it's on weight maintenance and staying motivated. I wanted to remind you that all the goodies you've gotten during the program were made possible by a grant from the American Society for Metabolic and Bariatric Surgery. Therefore, it's only appropriate that we discuss bariatric surgery, and it is an important part of treatment. Bariatric surgery may be an option if you're obese and have not been able to lose weight by other methods. It's recommended only for those with one of the following: severe obesity, which is a BMI greater than 40, that's been unresponsive to diet, exercise, and weight loss medications, or a BMI between 35 and 40 along with a serious medical problem that it would improve with weight loss. The goals of bariatric surgery: the main goal is to reduce the risk of illness or death associated with obesity. Other goals are more personal goals. It will help you look and feel better. It will improve your health. Will decrease the amount of money you spend on health care and medicines, will decrease the number of sick days used, and decrease the risk of developing chronic diseases. There's actually 3 types of bariatric surgery: lap banding, gastric bypass, also known as Roux-en-Y, and the gastric sleeve, also known as a sleeve gastrectomy. We'll talk about the lap banding first. Lap banding is also known as laparoscopic adjustable gastric banding, or LAGP. This is a surgery where an adjustable band is placed around the opening of the stomach. This reduces the amount of food that you can eat at one time. The size of the band can be adjusted after surgery, allowing you to eat less food or more food. Fluid's added to this band to make it adjustable, and by adding the fluid, it makes it tighter so that you will eat less. It's called a fill. So what this means is if you aren't losing weight at the desired or anticipated amount that you thought, then they may add more fluid to the band to restrict what you're eating. There are advantages to the lap band. It's very popular. It's simple to perform. It can be adjusted, as we talked about, or it can actually be removed. There are low risk of serious complications immediately after surgery as opposed with the other surgeries. And weight loss is 45 to 75% after 2 years. However, the results depend on your ability to follow the program. The gastric bypass, or Roux-en-Y, can be done laparoscopically or open surgery. Open surgery means the old-fashioned cut where you have a big scar after they're done. Weight loss occurs through decreased intake and decreased absorption of calories and nutrients. The stomach is divided, it's made smaller, it's attached to the small intestine. The smaller stomach holds less food, so you feel full sooner. The body absorbs fewer calories since the food bypasses most of the stomach and as well as part of the small intestine. Other things to know about the gastric bypass, or Roux-en-Y, is there's a high success rate with this surgery. People lose an average of 62 to 68% of their excess weight the first year after surgery. Weight loss levels off after 1 to 2 years, as it does with a lot of things, and usually with an overall excess weight loss of between 50 and 75%. So a person 120 pounds overweight would lose an average of 60 to 90 pounds. One thing you need to be aware of with this surgery, that this pouch can stretch over time and there can be weight gain. The third type is the gastric sleeve, or sleeve gastrectomy. The gastric sleeve also decreases the size of the stomach. It makes it into like a narrow tube. The new stomach is smaller, therefore there is decreased production of ghrelin, which we talk about. It's that hormone that increases your appetite. The gastric sleeve is safer than the gastric bypass because it's only the stomach and not the intestines that's rearranged, so there's less chance of malnutrition. The gastric sleeve also appears to control hunger a little better, and perhaps this is because of the decrease in the ghrelin. There's good success rate with this. An average weight loss of 33% of the excess body weight the first year. So a person 120 pounds overweight would lose about 40 pounds their first year. Now, all surgeries have complications. The most common complications, which occur 1 to 6 weeks after surgery, are bleeding, infection, blockage or tear of the bowels. There could be need for further surgery. Other post-op complications that are seen sometimes are blood clots in the legs and lungs. These are seen with any surgery. The possibility of a heart attack, possibility of respiratory failure or pneumonia, and for some reason urinary tract infections. What you can expect post-op is an average hospital length of stay of 1 to 3 days. As with any surgery, you would not want to drive while taking your pain medication. You want to begin your exercise program as soon as possible after the surgery as directed by your surgeon. You want to eat and drink exactly as they tell you to prevent any complications. And you need to be very much aware of keeping your follow-up appointments as they're scheduled. You need to be aware that this is not to be taken lightly. It's a major commitment. You must have a complete understanding of the risks and benefits of the surgery before you decide to do this, and you must be motivated and willing to make the needed lifestyle changes. If you don't do these things, it's not going to work for you. You'll either have complications or you won't lose weight. There are some mandatory lifestyle changes with the decision to have this surgery. You have to commit to staying healthy for life. You have to commit to exercise regularly. That means most days of the week. You have to eat sensibly as directed by your healthcare team. You will need to follow up as directed, and you will need to work through any psychological and emotional issues. Now, generally, these programs actually have a psychologist or a psychiatrist that works with them, and they interview and work with you both before and after surgery, as well as nutritionists and other members of the team. Eating after surgery, some guidelines would be to eat small, frequent meals and not skip meals. You have to chew your food slowly and completely so it will digest because your digestive system has been altered. You need to avoid eating while distracted. You have to be very much aware of when you're full, and you need to stop eating when you're full. It's important that you drink liquids at least 30 minutes before and after eating to help things go through the digestive system appropriately. You need to avoid foods that are high in fat and high in sugar. They're extra calories, but they can also affect how your food is digested. And there will be vitamin supplements prescribed that you need to take as directed to. Now, what you can look forward to after you have your bariatric surgery is you can enjoy a life without food as your major focus. You're going to feel much better about yourself. You're going to have much more energy. You're going to be much more active and involved in your family life. You're going to be able to wear regular size clothes. You're going to be able to tie your shoes. You're going to be able to walk without shortness of breath. You're going to have fewer medicines to take. You'll fit into seats like airplane seats, restaurant booths, and so on. And all these just make it so worth it. Results of this surgery are just miraculous. If you feel you need more information about this, at the hospital we always have Dr. Ramos. He's our bariatric surgeon. His phone number is listed there, but there are also websites you can go to. One is the American Society for Metabolic and Bariatric Surgery, and another is the Obesity Action Coalition. Thank you very much. We're finished with this presentation. Our last presentation will be weight maintenance and staying motivated. And I'll take any questions about bariatric surgery, and I'll try to do my best at answering them. Thank you.